Okay, thanks again for being here today for our random moment time study portion of the School Health Services mid-year training, our virtual session this afternoon. Appreciate you all being here and looking forward to our discussion. Today with us from PCG, we have John Ward, Rose Jensen, Jennifer Pham, and Tiara Glanton. From CDE, we have Omar Estrada. And from the department, we have myself, Olga Ginshin, and Tracy Gonzalez. We also have school districts and BOCES and some community partners joining us from across the state of Colorado. And with that, I will hand it over to Tiara, who's going to be presenting this afternoon. Thanks, Tiara.
Thank you.
Hey, Olga, actually, I was going to start.
Oh, sorry about that, Rose. Go ahead.
No worries. No worries. I'll kick us off and then I will definitely hand it over to Tiara. So thank you for joining everybody today. Our focus is going to be the random moment time study. So with that, we'll get going. This is the agenda. We're going to give you a quick program introduction and then get right into the random moment time study and then share some program contacts with you. So like always, we like to share the acronym lists with you. We have a couple pages here. These will be sort of littered throughout the presentation. So they're just a really good reference. As you know, the department sends out the PowerPoints in advance and then of course after. So if you're looking through this at a later date, you have these as a great reference. So just keep that in mind. So the overview for Medicaid in schools, we do talk about this in each of our presentations today. So if you joined us in one of the earlier sessions, this is the same information. So for that reason, I'll keep it fairly brief, but still want to touch on it. So we are guided by the federal government to start with. We'll go left to right. And that's really the Centers for Medicaid and Medicare, or Medicare and Medicaid, I should say, services, often referred to as CMS. They provide that guidance and program oversight, really governed by several things, including the Individuals with Disability Act, free and appropriate public education, and other laws that Medicaid agencies are responsible for really handing down at the state level. So with that, we'll move over to state government. So in Colorado, it's the Department of Healthcare Policy and Financing, often referred to as the department. They take the federal guidelines and use them to help shape the state SPA. So the state-specific language that we adhere to here in Colorado. There are nuances in every state that are slightly different. So our program is governed then by the state SPA and the time study implementation guide. That's our policy here. And the department is considered more of the policy experts. They administer the program. As you know, they issue you reimbursements. And so that's typically their involvement. I think you guys as district participants are pretty familiar with what the department does and how they manage the program. And then of course, you're probably most familiar with your role in the program as a district, knowing that you do sign that participation agreement and that enables you to participate in the program. And as long as you're in compliance and meeting all the program compliance requirements, then you're able to receive those reimbursements for those funds recovered. So the support to the program is quite extensive, really. I mean, we have a great support system in the state of Colorado, starting there with the department, as I just explained on the previous page. So again, they're the policy experts. They enforce those CMS guidelines. They organize all these wonderful trainings we put together and are able to get together for. And then, of course, they have oversight really over the entire program. We listed, approval, denial, random moment time studying, cost reporting, extension requests, things like that. But really, they have oversight of the entire program. And our great partners as well at CDE, Omar representation today, they help us on the back end of the program, right? So we help you recover those funds and the Department of Education, CDE, helps you spend those funds in a responsible way that aligns with sort of the mission of these types of programs. And then us, Public Consulting Group, we are the state vendor, so the department employs us really as an extension of them to help manage the day-to-day of the program. So you can always come to us with questions. If it's not something we can answer, we will always forward that to the department. But we work in tandem to help run the program daily. So just a couple of things listed there under us is the claiming system administrator. So we do provide that claiming system you guys use for both cost reporting and the random moment time study. We help manage those things. And then we also provide help through the help desk where you can send in your inquiries via email or give us a shout on the phone and we can help answer any questions you might have or direct you to the right folks to get those questions answered. And then last but not least, certainly is the stakeholders, and a lot of you participating districts make up those stakeholders. So they're typically experienced coordinators who have decided to lend an extra hand and really help shape the program and provide feedback on behalf of all you participating districts. So if you are not a stakeholder, you may have hopefully heard from your stakeholder asking you questions about how things are going. Do you have any feedback that can be shared in a greater group and that we get together with stakeholder meetings? We also have an enhanced area of knowledge for all the functional program areas that stakeholders have identified, and that is that we have a really great document located on the department's website with those area of knowledges designated by stakeholders. So it's really good information. If you're looking for an expert on a specific subject, you can locate that document and reference who exactly would be the best person to reach out to at the district level. And then of course we have community partners that also make up stakeholders like billing agents, and they also can lend a hand in helping districts understand the billing component of the program. All right, so that really brings us, as after the general overview of the program, to the RMTS section that we're going to dive into. So with that, I'm going to turn it over to Tiara to help us get started.
All right, thank you, Rose. So in this session, we are going to start off talking about or reviewing some statewide time study results from the OD22 quarter. And just keep in mind that these results are preliminary. And then we'll also talk about ways that we can continue to stay compliant and optimize our reimbursement. So on this slide, we see the time study results for the behavioral health personnel by job category. And if you look in the box to the right, we did include the number of moments and the percentage of moments that were distributed between each job category. And as you can see, social workers and school psychologists received the majority number of moments. Therefore, they had a larger impact on the time study results. Then when you take a look at the bar graph, when you look at the light blue bar, you'll notice that for your school psychologists and social workers, they did spend majority of their time performing direct medical services. And one thing we do want to highlight on this slide is that since the supervision requirement for school psychologists has been removed, we are now seeing that school districts are moving school psychs from their admin cost pool over to the direct service cost pool. We still have a couple of hundreds of the school sites left on the admin cost pool, but we did want to take this time today just to kind of let you know that we are seeing this transition and just to kind of see what are some things that you all are doing or reviewing to determine whether or not you are moving them from the admin cost pool to the direct service cost pool. So I'm going to take a pause, checking with you all to see if you want to give some feedback regarding what you see on the bar graph, and also give us some things that you have been doing to determine if your school sites are qualified to be on the direct service cost pool?
You can certainly unmute or use the chat if that's easier. But we'd love to get your feedback here. Did anyone notice the registered behavior technicians? They show 100% direct medical. I mean, that's something I noticed right away. Nothing? Well, they only have one moment that was distributed. So we included them here in the slide because they are new as part of the expansion to free care. So they were a new job category you could add. So we wanted to include all the new job categories. So you got your BCBAs, right? Your RBTs, your school psychs. They were newer as part of the expansion. So we wanted to include them, but what this RBT section tells us is that you guys don't have them or you haven't added them yet. You're working on it because they only got one moment.
So we did get something in the chat.
Go for it.
From Marley Hart. And Marley shared that I use a survey to determine if school sites should be on direct service, but all of mine are federally funded, so I haven't added any. So any feedback on that, Rose?
Yeah, that's a great point, Marley. I mean, obviously, if you have folks that are federally funded 100%, you can't include them. So that's a great point, Marley. So maybe some homework could be, and of course, this doesn't happen overnight. It's a process, right? Would be to work with finance for those of you who are in the same boat as Marley. If it's possible to work with finance to maybe shift some of those funding sources so that if you do have folks that would be reimbursable by nature of what they're doing and what they're qualified to do, to be reimbursed for this program, if there's a way funding sources could be shifted so where they're not federally funded, then you could, you know, recover some costs there. And that's not just specific to this situation, that's in any case, right? That's why it's really important to have that interdepartmental communication between areas within the district so that you can maximize the recovery of funds in this program. It's really a full circle effort at the district. So let's see, Rebecca says, I'm working with my AJ staff pool. I see some changes I'll make. Thank you. Great. Great feedback.
Hi, Rose. Leticia here.
Hi.
Question. I don't believe we have registered behavior technician at Aurora Public Schools. Who are these folks? Who are these providers? What are they, nurses? Can you give us an example?
Who are they? No, they're typically, from what we can tell, is they sort of do the work for the BCBAs. So the BCBAs are those prescribed qualified medical providers. They typically can write the prescriptions, and the RBTs can basically render the services under the supervision of the BCBAs. So I think that it's normal for some districts to just not have them is what the feedback we've been getting in these trainings. But if they are available and you do have them, we have expanded to that job category you can add. And the specific licensure requirements are in the program manual in 2 sections. They'll be in section 2 covered services, and they'll be an appendix to qualified medical providers. So that's really your best resource to nail down the qualifications.
Thank you.
Sure. Good question. Anybody else before we move on?
All right.
There you go.
So on this slide, we are going to review the time study results for our nursing and personal care personnel. And as you can see here, our health technicians and our personal care aides did receive the majority of moments. And on this bar graph, we did want you to take a look and see how in the dark blue, for the personal care aides and the health technicians, they reported that they spent majority of their time engaged in educational or non-medical services. So of course, those activities are not reimbursable in the program. And I'm going to take a pause so that you all can kind of review the results here and tell us what you think about what you see on this bar graph.
It's a lot of information, right? To sort of take in. I think to get the ball rolling, I'll just make a note of something on this slide. For these types of services, you can see on the over here on the bar on the right, the distribution of moments in the cost pool. You can see that health techs and personal care aides really are driving the direct service cost pool, because that's what you have the most of, right, at your districts. They're doing a lot of those activities of daily living services or nursing services. Sometimes people consider those like overlapping. So they're really driving. So what do we know to be true about those two types of job categories? Like, how do they differ from the other job categories in direct service? Let's see, Marley says, it looks like perhaps we as coordinators need to vet our pairs a little more closely or develop new screenings to make sure they spend significant time doing personal care. Not a bad suggestion at all. I think something that we're mindful of when we see numbers like this is that you guys, you know, there's a little bit of struggle going on with turnover in these positions, right? You're constantly seeing them turn over, or they're very mobile. So they'll move, you know, you'll do your diligence and vet and put people where they're supposed to go. And then a week later, they'll be switched, you know, unbeknownst to you. So there's a lot of switching going on from locations, from job duties and things like that. And because there's so many of them, it's a lot of work to stay on top of that. The other thing, and I'll pause there before I go on to the other thing, just to make sure I'm allowing others to chime in. Any other interesting takeaways?
Hello, I'm Nancy.
Hey, Nancy.
I want to maybe give my own thoughts about especially the personal care aides, teachers' aides. That is such a huge difference that they report non-medical activities. I think that, and this is what I'm trying to change a little bit the mind in DPS, is a lot of education, how they do things. If we have a personal care aide with kids who are who has an IEP and are in special education, one of the biggest things that paras do is safety monitoring, and they don't take that as safety monitoring. They think that they are answering like, oh, I'm helping such a student with his homework, or I'm helping, you know, I'm refocusing the student on his classwork or whatever. So I am learning that, and as I am learning and trying to pass that to the paras, because I am the one training the paras, is that it has to be kind of a change of, it's a mindset, right? Because no matter if they are helping with an academic skill, at the same time, they probably are doing a safety monitoring. Of course, everything has to be confirmed in the IEP, but it's a lot of work because paras change, they leave, new paras come in, and even the special education teachers, they are not knowledgeable about what it is the services. So then they go to the RMTS and they answer, very briefly, and it's a negative token for us. I don't know if I
Yeah.
make myself clear.
You are crystal clear, and Marley beat me to the punch on saying great point. That is a excellent point. Training, right? That's a tall task you've been issued to train the pairs, especially with the turnover situation. So kudos to you, but that's a real thing. So in your example with safety monitoring, right? That is a reimbursable service, typically assigned to a pair, like for a one-on-one service with a child, right? Whether it's behavior safety or maybe it's some seizure, because they can have a seizure, so they need someone assigned to them all day, pretty much.
Yeah.
Yep.
Uh-huh.
So there's a few reasons, or a few ways or reasons why they can be assigned safety monitoring. But the
Uh-huh.
thing is that the safety monitoring is a health related service. So it is important for that para or health tech, whoever they are, that they know the primary reason they are with that student. And that's how they should be really answering their moments, because everybody knows you can be doing multiple things at the same time, right? We're all multitaskers. You can be assigned to a kid and doing for a health reason and happen to be doing something else in the moment. But safety monitoring is one of those things where you can do something else and safety monitor at the same time, right? It's not like if you were feeding a kid, you probably aren't doing a whole lot of other things other than feeding them. But in a safety monitoring type of service, you can be with them and monitoring them and also be doing something else. So like Marley mentioned in that health hat role, if they're assigned to a student primarily for a health reason, they just need to know that. And if they allude to doing multiple things when they respond, which is honest and true, because they can be, we'll dial in, and that's where we issue follow-ups, like say, well, what were you primarily, why were you primarily with that student at the time of the moment? We will try to dig in, but if they don't share all the things to begin with, we don't know sometimes. So training on your part, huge. Great point, Nancy. Thank you for sharing. All right, well, I think we've got another slide. I think we'll head into admin. So,
So for our admin personnel, these are individuals who are performing administrative activities or coordination outreach activities. So on this bar graph, we're going to focus on the orange yellowish color a little bit more. And as you can see, the school counselors, they received about 705 moments. So 24% of the moments, and they had the largest impact on the time study results. However, they reported that they spent 9% of their time doing coordination or outreach activities. So let's take a second, look at the results we have here. What's running through your mind here? What do you see here?
some interesting stuff here.
And then they also, in the dark blue bar, reported they spent 51% of their time engaged in educational or non-medical services.
So who's getting the most moments in the admin cost pool? That's question one.
Marley said school counselors, correct?
Yep. So we'll just do a quick on the spot quiz here. Does anybody know, or can anybody throw in the chat, and it's okay if you don't know, recall typically, what the admin activity percentage statewide reimbursement is, what that percentage is that you're reimbursed on a quarterly basis? Anybody know or have a guess what percentage you get? Rebecca says 20. That's a good guess. Anybody else? Nobody else wants to play. Well, 20 is pretty good. We're not quite that high.
Oh, Nancy says 16%. Heather
Yes.
says 33.
Yes, 16 is more accurate. 16, 17. I mean, it fluctuates quarter to quarter, right? But what we've seen most recently is around 16, 17%. So if you keep that in the back of your mind, now that's a statewide, so that's all the admin activities in that cost pool particularly. What then strikes you knowing that on this list? Who's less than the state average? Who's way less than the state average? The counselors. I think the program specialists, the non-licensed workers, they're pretty close. Maybe a little work there we could do, but I think the school counselors really jumps out, if that makes sense to everyone. So school counselors, as you can see from the distribution of moments on the side in that gray bar, are driving the direct service cost pool with 24% of the surveys going to them. Okay, so they're diluting the reimbursable percentages. That means we can do a better job of vetting those counselors, because as we know, what we've heard from you is that you've got a lot of counselors, especially at the high school level, that are doing career planning, right? Career and college planning. And so at least what we've heard in the last 2 weeks in the in-person trainings was from, and particularly from stakeholders, is that they don't put high school counselors on their rosters because they are doing college and career planning and scheduling a lot. But at the lower levels, so at your junior high, middle school, and elementaries, they do more routine types of other activities like coordination and outreach that would be reimbursable for the program. So they include them, but not the high school. So again, that was a great tip, something that I wanted to share per the feedback we got in the other trainings. Does anybody else have a best practice they want to share that they use to help vet school counselors?
Hi, Rose. What she's again. We've sent so our, for the lack of better words, our broker is the consortium, and they have the mental health providers survey. So we send that survey to all the mental health providers, and based on their answers, we decide if they're going to be part of our staff pool list. One thing about our district is that a lot of school counselors, because of the lack of staff, are switching back and forth from different schools, maybe serving high schools on Mondays and Wednesdays, and then elementary schools on Tuesdays and Thursdays.
Okay.
So I have a love and hate relationship of my school counselors.
That's great. That's great. And that's feedback I hadn't heard before. So that's very interesting. Does anybody else have any insight that they want to share? Looks like there are some chat comments as well. So Laura says school counselors can typically do more academic side of things. Yep, we've heard that before as well. And that it does possibly depend on the school district, 100%. So especially when we're talking about the way a small district runs compared to a very large district, there's obviously going to be differences there and how the staff is used. And then Marley also is contributing, saying that they surveyed some years ago in her districts, and they just didn't do anything with enrollment. I take it that's Medicaid enrollment. So they really focused their energy on surveying and vetting their non-licensed social workers. So that's great. That's great advice as well. So yeah, that's all good points. I thank you all for commenting and being part of the conversation. I think the last thing I'll point out on this slide is those non-licensed psychs up at the top. Remember, these are the non-licensed psychs in the admin cost pool. And you may have them now able to move over to the direct service cost pool based on the supervision lift, right, that Tiara mentioned earlier. So just something to consider. We know that a couple hundred of these non-licensed psychs in this cost pool, the admin, are now on the JM, so the current quarter, the JM 23 staff pool list in the direct service cost pool as licensed providers. So when you think about that, it's important to consider that with less non-licensed psychs in the admin cost pool, more moments will now be going where? In this cost pool. If you remove providers, the distribution, the moments, sampled moments stay the same, right? So now they're going to be distributed amongst where? That's right. Counselors, program specialists, non-licensed social workers. So let's really think about that because, you know, as you know, that was just, I only have the intel for this current quarter. We've got approximately 200 that went from admin to direct service. I imagine that as people work through and vet their counselors, there may be more moving. It's just something to consider because it looks like they're driving our coordination outreach reimbursable percentages in this cost pool. And so if we're losing them to direct service, where, you know, these services are reimbursed in that cost pool as well, but in this cost pool, we could see it get lower if we're not really vetting our other folks on the list to make sure they're really doing those outreach and coordination and support services. All right, I think we can move on.
I think we have another question. Marley says, I'd love to know if this is a new trend or typical of past OD quarters. Could you share that with us later in the year?
Sure. I think is the ask the behavior of the non-licensed psych job category throughout previous quarters? Is that what I'm hearing?
I would be interested in the non-licensed social worker and school counselors more than the psychs.
Okay.
Actually.
So just in general, more of a history. Yeah.
All right, so before we get into the details of this next slide, I do want to make sure that I mention that as a state, you all are doing a great job with your RMTS compliance. From what I hear, you've always done a great job. So kudos to you all. And so even though we're doing a great job, we also want to just keep in mind some things or factors that can have a negative impact on compliance, as well as our ability to meet statistical validity. And so each quarter, we need to receive 2,401 moments in which participants are reporting that they were working in order to meet statistical validity. And so one thing that can have a negative effect on that is our not scheduled to work moments. And so as a state, under the direct service cost pool, we see that 9% of the moment responses were not scheduled to work. And your nurse aides and health techs were kind of leading those responses, those not scheduled to work responses. And then under the admin personnel cost pool, 5% of moment responses were considered not scheduled to work. And 37 of those responses came from non-licensed social workers. And so on the next slide, we also want to talk about other factors that harm our ability to meet statistical validity, and that's no responses. So right now as a state, you do have a low number of no responses. We want to kind of keep it there because it could have a negative effect on making sure that your responses are valid. And then vacancies. So moments assigned to vacancies are invalid. And therefore we understand that sometimes people leave the district. You have to go in, put in an end date, which creates a vacancy. But then we want you to remember that it is best practice to make sure that you go ahead and perform a direct replacement once you are able to identify the new staff member. So what are some ways that your district is working to make sure that we are achieving meeting statistical validity? What are some things that you all are doing?
We know you're
Um,
doing them because
oh.
you're doing a really good job. So someone share, please.
I want to share this. With my supervisor, we have been trying to increase the shifts, especially with school psychs and social workers. But the amount of schedules that these people have is amazing. From last year, I added like another 7 or 8 shifts. And I'm planning at least to add another 5 or 7 for this next quarter, trying to cut the gap in this about the non-working moments, adjusting their schedules. And then the other thing is trying to really keep an eye on the vacancies and instead of vacate someone when I know that someone is not there anymore, that it was termed, have already a list of people that are new that they can, with whom I can replace. But it's a lot of little work that you have to be on top of everything. And well, we are learning along we work.
Yeah, that's great. Thank you for sharing, Nancy. It is a lot of work, especially for some of the larger districts that have hundreds and hundreds of people on their staff pool list. And we know turnover has been an issue just nationwide, since the start of the pandemic. So yeah, and you guys, I'll just say, are doing a great job managing those. Our state return rate compliance is very high. It's in the high 90s. And the number of invalid moments that we see every quarter is pretty low, which means that you guys are managing your vacancies very well. So this slide is really just a reminder of how you can manage and impact the numbers in a positive way. It's certainly not of you need to do a better job of this. Keep doing what you're doing. And we really like to hear you share your best practices because that helps others, especially as new folks join the program or come into new roles at districts. So that's all great. And it looks like we have some comments too. So it looks like Chris Denny says frequent check-ins with paras and schedules. Yep, that's good. Marley says it's been hard to find vacancies. Some going on 4 to 6 weeks. Absolutely, we've heard that. It's a real struggle there. So let's see. Adeline says, I send out weekly reminders. You have a moment coming up. Keep an eye on out for your email. That's great. Yeah, you guys all have great strategies. So keep up the good work, really.
And then I want to say, I think, Rose, I'm not sure if you saw this one, but Marley mentioned working with school secretaries to get a better handle on shifts and to establish a system of notification so we know when staff, especially paras, leave or switch schedules. So that's also a good one.
Thank you. I did miss that one. That's a great one. Yeah, shifts is a huge deal. And Nancy, you mentioned it too. So creating and assigning shifts to folks helps limit them from being sampled when they're not actually working, right? So that also helps us meet our numbers. So that's great tip. And why that shift feature exists, right? That and CMS wants us to have it so that we're only sampling people when they're working. So kind of an important one. Yeah.
Rose, just a clarification. I was under the impression that we cannot send reminders of the upcoming random moment time study. So,
well, yeah, you really don't need to, even if you could, because the system, automatically sends that 24-hour prior notification. Plus, then they send the notification at the time of the moment. Then we have a reminder schedule where the system every 6 hours sends out a reminder. Don't forget to answer in a moment. Don't forget to answer. Don't forget to answer. Your due diligence becomes important when people aren't answering. So they're getting all those reminders and not answering. I would say the best use of your time would be checking the system to see then who hasn't answered, because a lot of times what you guys are finding out is those people aren't at work. That's why they're not answering. Or they're not getting the email. Maybe there was a typo in the email that just needs to be updated. Things like that, that you can, if you catch them early, change and update and resend a moment, or enter this person was on leave at the time and you didn't know until they were sampled, but they've been out for 2 weeks and they're not scheduled to come back for another 2. You didn't know. So now you need to be aware if as they continue to be sampled, to enter on their behalf that they were actually not at work. So yeah, that would be the best use. I think I'm not against emailing them, but we email them a lot, right? I mean, we hit them a lot to try to get, especially when we got reduced prior notifications, right? We used to have a 5-day, now we have a 24. So when that got reduced, we really upped the reminders and things to help. And honestly, statewide, it's going really well. So yeah, I mean, that's a personal preference, but I would say, yeah, they're getting a lot of communication about their moment.
I have a question.
Sure.
This kind of mystifies me. Like, the whole theory of this is to see what they're doing on those moments and to have it as accurate as, we can get it.
Mhm.
But if said person knows what time they're going to have a moment, why wouldn't they make sure they were working with a student at that time? I mean, how accurate can these results be if it's supposed to be random, but they know when it's going to come? Like, oh, I'm having a moment at 2:15. You know what? I'm going to make it look good. I'm going to make sure I'm working. I'm going to change this around. I'm going to be working with that student. How doesn't that kind of, is that a question there?
Well, so the purpose of the prior notification is not to rearrange your schedule. Right. That's 100% opposite of the intent of the prior notification. The prior notification is to let folks know that they're going to be sent a survey in the next day, and they need to be on top of responding to it, first of all, and just taking a mental note of what they're doing. A lot of people, you get a 24-hour notice, you work in a school, you don't have the luxury of rearranging your day around that minute. You have a set schedule. You're doing what you're doing every day with kids. Regardless, you're not rearranging your schedule around these time studies. Should never, ever be the case. And I think typically isn't, because you just don't have that luxury to do that. That's not how schools work. And so really just the intent of the prior notification is to let them know you're going to get this email. Don't delete it. Don't ignore it. Take note of the time so that when you have the availability in the next 2 days after to go in and answer it, that you remember what you were doing. Because it's really hard to remember 60 seconds of your day from the previous day, right? Unless you're thinking, I should be trying to remember and taking note of where I am today throughout. And that's really what it's for. I don't know if Olga, you wanted to chime in and say anything I may have missed, or
no, that's,
we got it covered.
You hit on everything that I was thinking, particularly if you just look at the opposite of what you were saying, Vicki. I think it's very hard to go back and remember.
Yeah, I get that.
Yeah, and then an argument could be made that it would be less accurate if you were trying to remember than if you knew. You could make a note of what you were doing, but also, I guess, just make sure that you're training your staff that they should not be rearranging their schedule. Right. They need to know the intent of the random moment time study, and they need to know that it's honest and it's unplanned. So whatever they were doing at that minute, whether it was not working at all, going to the bathroom, en route between schools, it needs to be honest and unplanned, because it is a big point of auditing for CMS. And it's very important, regardless of if you are on the direct service staff pool or the admin staff pool, doesn't matter. honest, unplanned, and it's what you were doing. And everybody that's on your staff pool list should know that so that they're prepared. Thank you for the question, Vicki.
Sure.
All right. Good discussion. So, Tiara, I think this leaves us with our last slide.
Yeah, so we did want to end with 2 exciting new features in our PCG claiming system. One feature is regarding the moments. So previously, follow-up moments did not contain the hyperlink to the moment prior to this current quarter, which is the JM23 quarter. So in a stakeholder meeting, it was expressed that it will be helpful for coordinators if the follow-up moments did include the hyperlink in the original moment. So we did implement this quarter, and we heard you, and we also value your feedback, and we want to share this with you today in this meeting. For shifts, now, whenever you go in and you start working on your staff pool list for your state opened February 1st, you will be able to see that once you go and certify, the system will trigger you to go back and either edit or review your shifts just to make sure that they're accurate. So if you get something that's outside of normal business hours, you'll definitely receive a prompt to go back and just make sure that what you've entered was correct. So you should be seeing that implemented for the AJ23 staff pool list.
Yeah. So that'll be something new. Like Tiara said, that you'll be hit when you go to certify. I know nobody's certified yet. We just opened the staff pool list, but you are probably familiar with all the email follow-ups that we send you after you do certify, as just part of our check in the system to make sure everything looks like it should. And so Tiara mentioned that you may have a shift that triggers an edit to prompt you to confirm or revise. An example of that may be, you have a shift that started at 5:30 and you assigned that to somebody. That would automatically be triggered, and you would have to confirm it or revise it. Now, we would not be sending that to you in an email follow-up. If it's triggered in the system, you're not likely to now receive those extra follow-up emails. So we're really hoping to reduce the administrative burden on you. We know a lot goes on quarterly around that time, and we would like to have to reach out to you less if we could embed it in the system and get that automated for you. Any questions or thoughts on the new stuff?
Anything you'd like to see in the future?
Question. You guys have anything on your wish lists?
Yes, I do.
Oh.
Perhaps have more time to complete our staff pool list in the quarter when the school just starts in August, at least for our district, because it's always very rushed. And as you know, we are struggling to find employees, and I feel that quarter for our staff pool list is really a not so pleasant show. Something to consider.
So what you're wanting is more time leading into October. So it doesn't really help if we open it earlier, because that's too far in advance, because you're not really getting your positions really nailed down until closer to the start of the quarter, right?
Correct. It's a lot of hiring happening. The day that we sign up for the staff pool list, we have like 20 new hires.
Yeah.
So, and I have talked to other districts, and I feel that a lot of them are in the same position as we are. So that's why I want to bring this up to your attention.
Yeah. So, nope, that's a good point. So I'll just respond with a couple of things. So first, we can't extend the time closer to the quarter a whole lot, because we have to review and 100%, of everyone participating statewide the staff pool lists for a variety of things to make sure we look good and we're okay to proceed going forward. So there's a certain amount of time we have to build in to review what you've certified. So unfortunately, there's kind of not a lot of wiggle room there. But for that reason, we allow you to just contact us if you have updates, and we will, on a case-by-case basis, open up for you and let you add to a certain point. We have a drop dead date that we then can't open anymore because we're doing too many things to get ready to generate the sample. But we do allow a good couple of weeks after certification where we'll say, just email us and let us know what you need. And if we can accommodate, we absolutely will. And some of you know that well, you hit us up with that, and we're always opening and closing. They're typically minor, but little things you want to tweak or update. And then the other thing I wanted to point out is direct replacements. So typically by the end of every quarter, you have a list of vacancies, right? Because real life happens and people leave in the middle of a quarter. As you know, the July through September quarter, there is no time study. However, you have people on your staff pool list that have rolled over from the previous quarter. So you have a list of vacancies. If you have a list of new hires also, and you continue to get them even after you've certified your staff pool list, you can always direct replace them as long as they're in the same job category and have the proper credentials if it's in the direct service job category, right, to be in that position. And that is a way you can get them on if they're hired late going forward. Does that make sense? You don't always have to just delete your vacancies and add brand new. You can do a direct replacement to help mitigate the loss there of people you can't seem to get on that staff pool list before the quarter starts.
Right. If we have the people.
If you have them, yeah.
And Marley says a wish list for the claiming system is a function that will sort our rosters by shift on that staff pool tab, just like we can with ID, location, and job category.
Okay. That's a good one. Write that down. Thank you, Marley. Did we miss somebody else? It looks like Vicki had some comments. Sometimes you just don't have the people to fill. That's okay. You can just remove them and add them when you do to the next quarter. Or maybe an opening comes up and you can direct replace. Yeah. All right. Well, I think that concludes our RMTS portion. And all we're left with now is just to remind you about those program resources. So don't hesitate to reach, well, we have contacts as well, but this is referring to our resources at your fingertips. So the School Health Services program on the department's website, the PCG claiming system under the resources tab on that homepage, have in combination all of these bulleted items here. So yeah, we encourage you to utilize those. The School Health Services program manual is pretty extensive and very well organized by section. So that is probably the easiest thing to refer to. And I'm definitely promoting that. It's a great tool, especially if you're newer to the program. And then just the contact information. I think you guys know how to reach us, but we are giving you Olga's direct information as well as Omar's direct information here. And then with PCG, we do offer a couple ways you can reach out to us regarding any parts of the functional program, whether it be cost reporting, financials, random moments, or anything in between. If we don't know it or need to direct you to Omar or Olga, we will. So I think with that, we will conclude for today, but those of us at the department, PCG and CDE will be hanging out for a little bit. So if you'd like to ask us any questions, we will hang on for the next 5 minutes or so. And thank you for joining, everybody.
We have a question from Laura.
Sure.
Can you add the 1, 2, 3, 4, 5, 6, 5 tabs where you search for the providers up on the top also? This way you do not have to scroll all the way to the bottom. Search tabs.
I don't know what the numbers you're referencing are, Laura, but
Sorry. I didn't know how else to put that.
there is a filter.
That's what I meant. For 1, 2,
Okay.
3. On the bottom when you're looking at the whole all your providers on each screen, you got to go to the first tab. You only have A through whatever D on there or whatever.
Oh, like there's a limit 100 to a page. Is that what you
Yeah,
mean?
correct.
Okay.
Can you put that at the top too? I just a thought.
You mean like this is the 100 of your 800 people on your staff pool list, something like that?
How do I want to put this?
I think it's those
No, I get
navigation
it.
numbers to go through pages of provider.
Correct. Can we put that at the top also?
Oh, I see. So you don't have to
All the way to the
scroll all
bottom.
the way down to hit next.
Correct. Or go to
I
the
got
next
you.
tab or go to the next, but number is what I meant. Because I think there are numbers, aren't they? 1, 2, 3 pages.
Yeah, pages. Hmm.
Yeah. It would be easier. Sorry, I couldn't. I'm like, how do I express this?
I'm following you now. I'm following you now.
I don't know if
Marley.
you can. It's just a thought.
Yeah, we also have a filter feature, and unless you expand, you can forget that it's there. So like if you're looking for, if you have say 800 providers and you have 8, that means you have 8 pages, right?
Correct.
8 plus 8 or 9 pages. You can just put the last name T, enter, and everyone with a T will pop up on your list with a last
Really?
name T.
Where's
Yeah.
that?
So I can't remember what it's called. I can't remember if it says, I think it says available filter, if I'm thinking correctly.
Look.
And when you click it, it expands and then it lets you sort or pick by a variety of things. Name, first and last name being separate options. So if you would just want to look at your S's, you can just put an S and type filter or enter, and then all your S people with starting with the last name S's will come up. Just,
Where do you put the S though? I don't.
in the last name field. So they're free form where you can type in the whole person's. If you know someone's last name is Smith, you can type in Smith and enter, and that will come up. But if you can't remember, or you know you're going to butcher a spelling of a complicated name, you could just simply put S, enter, and you'll get a whole list.
Okay, I'll have to
Of
play
S's.
around with it. I guess. So must have been having technical issues here. Sorry.
No worries.
That's
Thank
cool. I
you.
didn't know that. That's awesome.
Yeah.
Yeah, and if you want, you can always give us a call and we can walk you through some of those functions.
Okay.
Awesome.
Some of those like quick tips. Yeah.
All right. That sounds great. Thank you very much.
Okay, no problem.
Thanks, everyone. We'll hang out just a couple more minutes because we do have to turn it around fairly quick for our next session at 2:30. That's going to be the financial portion for annual and quarterly cost reporting. And you've got another question here.
Do I? Let's see. Can you explain why it's important to know if the day was paid versus unpaid when off? It affects the codes, which are outlined in the time study implementation guide. There's a coding, how do you say it? It's not a legend, but it's coding descriptions is located in the time study implementation guide, and how we have to code by that. That's the state and federally approved document policy. So we have to know in order to assign it to the right code. Yep. And that's also in the program manual as one of the appendices.
Okay, I think we have about 4 participants still hanging on here. We are going to have to wrap it up here, but Diane, Vicki, Nancy, if you have any other questions.
No, I just want to say goodbye until
Oh, okay.
Tuesday.
Thanks,
Okay, thank
Nancy.
you, Nancy.